Hi, I'm Dr. Pizano, and today we're going to be talking about chronic and acute musculoskeletal pain and some of the dietary supports that may help with these issues. So, I think it's really important first to note that there are lots of different types of pain, and you may personally have experienced several of these types, across your lifetime, and certainly for some of you, even within the same day. And so, we can have musculoskeletal pain, visceral or deep organ pain, headache or orofacial pain, neuropathy. But for today's talk, we're really going to concentrate on musculoskeletal pain that's associated with inflammation, which is something that diet can certainly help with. So when we start speaking about inflammation within Ehlers-Danlos syndrome, this is complicated. It's not just about having a doctor run C-reactive protein and sedimentation rate, looking at normal levels and saying, I don't have inflammation. And I think many of you will probably have that resonate where the lab tests look perfect, but you clearly have clinical symptoms. So, one of the things I think is really important to understand is that inflammation is actually designed to be helpful. In the body, it's used to help defend against various kinds of infections. It's important for helping to heal injuries as they occur and clear cellular debris. And it's going to bring blood to an injury site to help with both the healing of the injury as well as waste removal for the site. So when we start to think about this in the context of hypermobility and all of the challenges we have with connective tissue disease, clearly we can see that inflammation is going to occur quite often just based on some of the subluxations, dislocations, and injuries you might be experiencing. So when we start to see this chronic inflammatory state, this means these inflammatory cells are just going to keep coming and coming into the site even after that problem has actually resolved. And so what we see is this can cause damage rather than help the body. So let's talk a little bit about oxidative stress because this can be part of that inflammatory process. So with oxidative stress, this happens when we have an imbalance in the number of free radicals that are created from various processes that might occur in the body. As opposed to the antioxidants that we take in from our diet. And so what we end up with is too many free radicals, which can actually induce damage to the cells and the tissues, causing inflammation, which is our connection to inflammation. In terms of why we might have oxidative stress, this can happen just from being exposed to pollutants in your environment, going outside and spending some time in the sun. Certainly, some of our lesser lifestyle choices, things like smoking and excessive drinking, can cause this. And certainly, stress can also be a big factor that can be challenging for us to control. In terms of the symptoms you might have with oxidative stress, fatigue is a big one. And of course, that's a really common one we see in EDS patients. Cognitive issues and brain fog, joint and muscle pain can be a problem, challenges with vision, and sensitivity to noise. And clearly, these are things we generally find in this patient population anyway, but certainly controlling oxidative stress might help to reduce some of those symptoms. So when we have these long-term oxidative stress challenges going on that are causing inflammation, they're likely to exacerbate your already current EDS symptoms. So one way that we really can do this, and I'm sure you've all heard this, is focus on a diet high in fruits and vegetables. And that's a really good way to combat all of those free radicals because that's where we find the majority of our antioxidants, which include vitamin A, C, E, beta carotene, lycopene, lutein, and selenium. So really think about getting as many different brightly colored fruits and vegetables into the diet as you can. Some fun ways if you do well with different foods and trying things is just to experiment. Go into your local grocer and pick out something you've never tried before that looks interesting and find a way to prepare that and enjoy that in your diet and kind of rotate through. It's a great way to make sure you're getting a diverse amount of nutrients that might help combat inflammation and oxidative stress. So something very, very general that we can think about is hydration. Hydration is so important. And I know a lot of you are thinking, yes, I'm really careful because I have POTS. But it's also really important for increasing, helping with oxidative stress to decrease inflammation. It's used to flush out toxins and keep your joints lubricated. And for those of you who might not be trying to get in large amounts of fluids for POTS or who struggle, at least aiming for half of your body weight in pounds in ounces per day makes a lot of sense to make sure you're at least minimally meeting your hydration goals. If you're not a big fan of water, but want to sort of make it a little bit more interesting or fun, you can do things like adding fruit or cucumber or fresh herbs to perk up the flavor. Some combination can be really nice. So cucumber and mint is a really good one if you're looking for something fun. You can also get hydration from herbal teas, smoothies, and soups, and even a salad that has a lot of water content will provide you some of your fluids for the day. In terms of other things we can focus on, fiber is a really important one, and it's a little complicated. It really is going to depend on your unique EDS body, whether you do better with higher fiber intake, moderate intake, or lower intake. So I do recommend playing around with this and really seeing what works for you. But overall, we find that fiber is essential for creating a really good microbiome. Basically, these good bacteria in the gut are going to break down fibers and create what we call short chain fatty acids. And that's really important for activating an immune cell called a regulatory T cell that's important for decreasing inflammation. And so we want to have lots of fibers to a tolerated level. We don't want to be exacerbating other symptoms like diarrhea or gastroparesis for sure. But that is a really important thing. And even if you can't focus on a lot of fiber content, really think about decreasing some of these processed foods, refined sugars, excessive saturated fats that can really exacerbate oxidative stress and inflammation. Another great way to handle inflammation is to think about increasing the number of plant-based meals. Now, I'm not telling anybody that they have to be vegan. That's a choice that some people actually make. But we do know that when we eat lots of plants in our diet, it is associated with lower levels of C-reactive protein. It can decrease oxidative stress. And generally, we gain a lot of health benefits. A good example of an omnivorous version would be the Mediterranean diet, which is, I personally think, a really great option for many people in terms of ability to kind of work it into our daily life and enjoy foods that we like, but still have a lot of health benefits. We also want to look at vitamin A in the diet. We talked about it as an antioxidant, but it really is very important for helping with inflammation. From an immune perspective, it can help with the pro-inflammatory T cells and inflammatory cytokines. And cytokines are really just a chemical messenger in the immune system. And some of them cause inflammation, some of them reduce inflammation. We need them in the right amount. So having appropriate diet options can make a big difference. I will say that everywhere that we're talking about these specific nutrients, I'm really talking about getting them from your diet and not so much from supplementation. So in the case of vitamin A, animal proteins are a great source, but we can also get them from things like carrots and sweet potatoes and peppers. Look for those bright orange and yellow colors, and that's where we'll find vitamin A in our plants. Supplementation, on the other hand, we need to be a little bit careful with because vitamin A supplementation is actually contraindicated in pregnancy because it can cause birth defects. So we just want to remember food first is always really a good way to go. So one of my favorite spices is turmeric, and it is a beautiful orangey yellow color. It's found in Indian and other East Asian cuisines, and it is highly anti-inflammatory. It is one that, if you're not used to eating it and you have some histamine-based challenges, you might want to be careful with because it is a little higher in histamine. But if you don't have those challenges, it is a great way to spice up some rice. It is one of the predominant flavors you find in curries. It's great on proteins or as part of a tea or golden milk, which is usually coconut milk, although you can use on any kind of milk, dairy or otherwise, with turmeric and ginger, cinnamon, and black pepper, which is a really nice anti-inflammatory drink. We do find that from a laboratory perspective, it can decrease C-reactive protein and sedimentation rate. It is helpful for things like pain hypersensitivity, and does help with a variety of other inflammatory pathways. I know I have a lot of sciencey things on slides. Don't let it overwhelm you. It's there for those who really are interested in that side. But I promise to break down any of the really important science for those of you who might feel a little less comfortable. So in terms of ginger, which I mentioned in that golden milk, this is another favorite for helping with inflammation. It's great for decreasing pain, has similar mechanisms as some of the non-steroidal anti-inflammatories, and downregulates something called nuclear factor kappa beta, or NF kappa B. This is a really common target in the immune system for inflammation. So we really want to control that. We also find that inhibits substance P, which is something very much closely associated with pain. More importantly, in practical use, in 2 different studies, ginger was found to decrease pain in those with osteoarthritis. It is a really nice one to incorporate. Ginger tea is lovely. It's fantastic in Asian dishes. It works in desserts. It's really nice. I love keeping fresh ginger around. You can just split and then dice it up and add it into various kinds of stir fries and dishes. Resveratrol is another great option. We often think of this one from a supplement perspective, but it's actually a natural compound that's found in items like grapes, peanuts, blueberries, raspberries, cranberries, bilberries, and everybody's favorite, dark chocolate. So this is an antioxidant that is highly anti-inflammatory. It's great at bringing down the COX and pathway and bringing the pain relief that way. But it's also important for bringing down inflammatory cytokines, particularly IL-1 and IL-8. So it's one we can certainly work on as a supplement, but including these foods in your diet to me is an even better way to ensure that you're working on things from a more natural perspective. Omega-3 fatty acids. So when we think about omega-3 and omega-6 fatty acids, these are our essential fatty acids, meaning we can't produce them in our body and we need to take them in from the diet itself. And we do need both. What we think about with our omega-3s are these are our anti-inflammatory versus omega-6s, which can be inflammatory. We typically want to have a ratio of omega-6 to omega-3 somewhere between 2 to 3 to 1. I personally like 2 to 1 for my own body. You might find that to be a little bit different. When you think about omega-3s, this is going to be found in our fatty fish. We can also find it in plants like flax, walnut, chia seeds, and soy. Whereas we find our omega-6s and mostly in our nuts and seeds. So flax, sunflower, and safflower, and rapeseed oils. It is found in eggs and meat. It can be found in tofu as well as in fatty fish. And so we really want to make sure that dietarily, we're choosing some of these healthier omega-3s in larger quantities versus a lot of the processed and refined foods are using sunflower, safflower, or rapeseed oil, which is how we tend to bring up our omega-6s, as well as having a lot of meat in the diet. Again, food first. Yes, we can take a fish oil supplement. Just keep it in mind that it does have a blood thinning effect. So if you have issues related to that, or if you have an upcoming surgical procedure, you're going to need to be a little bit careful to not take in omega-3 supplements. So when we think about omega-3 fatty acids, this particular 2022 study looked at 503 adults in the United States and specifically looked at that omega-6 to omega-3 ratio and the presence of TMJ kinds of issue as well as low back pain. had higher levels of omega-6 fatty acids versus omega-3s did have more pain levels. We found that particularly in men, but not in women, which is kind of an interesting one. So I do think that it is important for everyone to have appropriate levels of these omega-3s. How much pain they might relieve for you, though, might be somewhat linked to gender. Olive oil is one of my favorite cooking oils. As I said, I'm a big fan of the Mediterranean diet. It does contain phenolic compounds. It's an antioxidant that's essential for helping with oxidative stress. And we do find that the oleic acid that it has actually is very anti-inflammatory. It has lots of other anti-inflammatory compounds as well. And we do find that high intakes of olive oil do decrease C-reactive protein levels. So another really good one to incorporate in the diet. The big thing to remember when you're using olive oil is you don't want to bring it above medium heat. It does have a lower smoke point, so this is a good one if you're using lower cooking temperatures. Or one of my favorites is using it to drizzle over, salads and vegetables, or to dip something into, rather than using it just as your major cooking oil. If you're using low temperature, which I typically suggest more often than not as another way that we can control oxidative stress, though, it is a great oil to use. So let's shift gears a little bit to acute musculoskeletal pain. This is when we have a recent injury. It could be a subluxation, or it could be surgery, and that's going to change and increase certain nutritional needs. The first thing is to make sure that you're eating sufficiently. Oftentimes when we have pain, it will decrease appetite, and for some people, might even cause nausea and vomiting if the pain is extreme. However, when we don't eat sufficiently, it gets in the way of your body's ability to heal. Depending on how severe the event was, it can increase caloric needs by as much as 250%. So just making sure that you're getting sufficient calories is important. We do need carbohydrates, which are really helpful for production of what we call ATP, which is our cellular energy. Dietary fats are essential for helping to create appropriate cell membranes and coat our nerve cells with the myelin sheath. So we want to include all of these in the diet. Protein is also really important. It helps to bring new blood vessels to the injury, which helps with healing. It is also helpful, of course, for rebuilding the muscle and helping with wound repair, particularly the amino acids, which are building blocks of protein. Arginine, glutamine, and leucine are essential for this. In animal protein, dairy, but we can find it in soy, we can find it in protein powders, and you can find it in most foods at some level or another. So really know that you can get protein from lots of different options, and vegetarian proteins can be quite helpful as well. We also want to think about the fact that some of these have a lot of specific uses. So I mentioned arginine before. It's a precursor to a neurotransmitter called nitric oxide, and that's really important for the inflammatory phase repair and collagen production. Glutamine is actually found in the highest amounts in the body in terms of amino acids, and it's important for the immune function, antioxidants, metabolic functions, super important. And then leucine is a branch chain amino acid, and that's very important for protein synthesis and wound healing. So make sure you're focusing in getting sufficient protein in for your body. Some other nutrients, zinc, super helpful in wound repair as well as the immune system. We can find it in lots of different fish and shellfish. It's in chicken, beef, pork, egg yolks, milk and cheese, legumes, and nuts. Vitamins, of course, we want to get enough of them in general, but particularly vitamin A, vitamin C, vitamin D, and B12 are really helpful for recovery. I would emphasize vitamin C in particular as being needed for collagen synthesis, and it is found in citrus fruits and cruciferous vegetables like broccoli and kale, certainly in your berries. So remember, food first. We're not necessarily talking about supplementation for any of these things. And that is going to wrap up my talk for today. And I hope that you learned a little bit about some dietary ways to help with oxidative stress and inflammation. Thank you.